Hi, this is Dr. Fox, and let's talk about the muscles of the neck. In this video, we'll take a very high-level view of certain neck muscles and groups of neck muscles. The first muscle that we'll discuss is the platysma muscle. The platysma muscle gets its name from the root platus, meaning flat. So like a platypus has a flat bill, the platysma muscle is very flat. It's a very superficial muscle found within the anterior and lateral superficial fascia of the neck. So if you were to remove the skin of the neck, within that subq, we would see the platysma muscles. So the platysma muscles are found throughout the anterior and lateral neck, and they drape down over the superior part of the thorax. So when they are tense, they make the neck flat. So as to think of an individual when they're shaving their neck, they'll flex their platysma muscles so as to bring the hair follicles of the neck into good contact with the razor. In addition to tensing the neck, it's also a weak depressor of the mandible and the lower lip. And it's innervated by the cervical branch of the facial nerve, which is the seventh cranial nerve. Now, as we go deeper within the neck, we'll come across the sternocleidomastoid muscle, or just the SCM for short. Sternocleidomastoid is a very long name, but it's a very helpful name. So if we were to break this down into its constituent parts, sterno references the sternum, cleido references the clavicle, and mastoid references the mastoid processes of the occipital bone of the skull. This particular muscle name reflects all of the muscle's attachment sites. So its superior attachment sites include that mastoid process of the skull, as well as the superior nuchal line. So about that. Its inferior attachment sites include the manubrium of the sternum, that's that anterior bone of the thorax, as well as the medial third of the clavicle. So when this muscle contracts, we could think of it in two different ways. So with unilateral contraction, just one of these muscles contracting, we'll have lateral flexion. So that's flexion to the side, as if you're trying to touch your ear to your elbow, and rotation of the neck. So you would begin to point your chin up in the opposite direction of the shoulder that you're pointing towards. There's also bilateral contraction, where both SCMs are firing, and that would bring flexion of the cervical spine, such as touching your chin to your chest. The sternocleidomastoid muscle is innervated by the accessory nerve, or cranial nerve 11. The accessory nerve is a mainly motor nerve, so it has very few sensory components. The afferent, or the somatic sensory components coming back from this muscle, are being conducted from fibers of the second and third cervical spinal nerves. So the SCM pairs well with the trapezius muscle. These are invested by the same fascia, but the trapezius muscle is found along the posterior and posterolateral aspect of the neck, as well as the back. For our purposes, we're only really considering the portion of the trapezius muscles which are found in the neck, which are the descending fibers of the trapezius. These take their superior attachments from the occipital bone, specifically the superior nuchal line, as well as the external occipital protuberance, which is found in the posterior aspect of the occipital bone. There are also attachments that run down the midline, which include the ligamentum nuchae, which is the ligament of the neck, as well as attachments on spinous processes C7 through T12, going all the way down the central aspect. The distal attachments of this bone include both the clavicle as well as the spine of the scapula. So here we can see the spine of the scapula, or the shoulder blade, and it goes out to the clavicle as well. The actions of the trapezius depend upon which fibers are contracting. So, for instance, it may retract, depress, elevate, and also superiorly rotate the scapula. When we consider those descending fibers acting alone, those are going to elevate as well as superiorly rotate the scapula. Superior rotation of the scapula is if you're elevating your scapula and also abducting your arm, so making it so that you're pointing towards the sky. The trapezius muscle is innervated also by the accessory nerve, cranial nerve 11, and like the SCM, its sensory branches are being conducted via different nerves altogether. In this case, fibers of cervical nerves C3 and C4. Turning our attention to the anterior aspect of the neck, we have what are known as the infrahyoid or the strap muscles. The infrahyoid muscles get their name because they are found below the hyoid bone, sometimes called the strap muscles because their appearance is as straps. So these are found superior to the sternum, medial to the carotid sheaths, and that's something that we're going to cover shortly. I'm outlining one of the carotid sheath there. And superficial to the thyroid gland and the larynx. The thyroid gland you can see here, and the larynx we can see there. So they're going to be superficial or anterior to those structures. Let's take a look at these on a cadaveric photograph. The infrahyoids separate into both superficial and deep layers. The superficial layers include the sternohyoid, running from the sternum to the hyoid, whereas the other superficial muscle goes from the shoulder blade to the hyoid, and that's called the omohyoid. Omo means shoulder. We can see that one has a little intermediate loop of connective tissue that tethers that muscle down. The deep muscles are collinear to one another, so if you were to reflect away that sternohyoid muscle, we would be able to see the sternothyroid muscle going from the sternum to the thyroid cartilage. We can outline that thyroid cartilage there, specifically to the oblique line of the thyroid cartilage. And then above that, or superior to that, is going to be the thyrohyoid muscle. So those muscles will look like they are linear with one another with only a brief, mild interruption at that oblique line of the thyroid cartilage. The infrahyoid muscles are innervated by the ansa cervicalis. Ansa cervicalis is one of the two major motor outputs from the cervical plexus. Here it is highlighted in lime green. So ansa means handle. It has a loop that looks like a handle, cervicalis of the neck. And so it will have superior fibers from C1 and then inferior fibers from C2 and C3 going down. And then branches go out to the infrahyoid muscles. So the cervical plexus or the handle of the neck has also sensory components to it, and that's something that we'll get into in a later video when we discuss nerves. Those superior limb or C1 fibers are usually associated with another cranial nerve called the hypoglossal or cranial nerve 12, and so as the C1 fibers exit, they follow along the hypoglossal fibers. Some of them contribute to ansa cervicalis. Some of them are going to innervate the thyrohyoid muscle directly. That's a very unique innervation among the infrahyoid muscles. And some of them will go out and innervate a suprahyoid muscle that we'll discuss shortly called the geniohyoid. So when we think of ansa cervicalis, it's innervating all of those infrahyoid muscles with the exception of thyrohyoid. So let's take a look at these muscles and their attachments in a little more zoomed in. So we have the sterno, from the manubrium of the sternum, hyoid to the hyoid, muscle. The sternohyoid muscle is going to stabilize the hyoid in conjunction with the functions of other muscles. And when it contracts, it will also serve to depress the hyoid bone. The other superficial infrahyoid is the omohyoid, going from the shoulder blade up to the hyoid bone with that intermediate tendon that connects it to the clavicle. It, like the sternohyoid, is going to both stabilize the hyoid and depress the hyoid, and it shares that common innervation, the ansa cervicalis. And then as we go deep here, we can see a little better the sternothyroid muscle. That sternothyroid muscle goes from the sternum up to the oblique line of the thyroid cartilage, and when it contracts, it is going to pull the thyroid cartilage of the larynx and the remainder of the larynx inferiorly, so that is part of the deglutition or the swallowing sequence, and it is innervated by also ansa cervicalis. And then we have the thyrohyoid, so from that oblique line of the thyroid cartilage up to the hyoid bone. This muscle will depress the hyoid or elevate the larynx. It may do either. And its innervation among the infrahyoids is very unique. It is innervated by only C1 fibers, so not by ansa cervicalis. And those C1 fibers hitchhike along with the 12th cranial nerve or the hypoglossal nerve. And this is something that we will see in the third week when we discuss the face. Moving right along, we have the scalene muscles. The scalene muscles get their name because they look like scalene triangles. And there are 3 sets of scalene muscles. There are anterior scalene muscles, middle scalene muscles, and posterior scalene muscles. The anterior scalene muscle is very important in terms of an anatomical landmark in the root of the neck, and we can outline that muscle here going down. It's going from the transverse processes of cervical vertebrae down to the scalene tubercle of the first rib. And there are some neurovascular features that we'll discuss in the context of the root of the neck that are immediately posterior to that anterior scalene and immediately anterior to the middle scalene muscle. That middle scalene muscle is also very closely associated with the posterior scalene muscle. So both the anterior and the middle scalene muscles go from the transverse processes of cervical vertebrae down to that scalene tubercle, whereas the posterior scalene muscle goes down to the second rib. Now, when these muscles contract, they may do one of 2 things. So with the rib cage stabilized, they can, when contracted bilaterally, flex the C-spine, or they can unilaterally, laterally flex the cervical spine. So that's take the ear. With the C-spine stabilized, the scalene muscles act as accessory muscles of respiration, and that they elevate the first and second ribs. And by doing so, they expand the volume of the thoracic cavity, which helps with inspiration or bringing air in. These scalene muscles are innervated by branches of the ventral primary rami of various cervical spinal nerves. So here we have a look at the first rib, and we can see that scalene tubercle there. And in the context of the root of the neck, we will see how the subclavian vein runs ahead of that scalene tubercle, and the subclavian artery runs posterior or behind that scalene tubercle. Next up are the suprahyoid muscles. So we have the infrahyoid muscles, which are below the hyoid, and the suprahyoid muscles, which are found above or superior to the hyoid. These muscles variously attach the hyoid bone to the skull and are important in the swallowing or deglutition reflex in elevating the hyoid bone. So there are four major pairs of suprahyoid muscles that we'll see in coming labs. These include the digastric muscles, so di meaning two, gastric bellies. The digastric muscles have an anterior belly and a posterior belly with an intermediate tendon between the two of them. And they're going to actually have, interestingly enough, separate innervations. So the anterior belly is innervated by a branch of the trigeminal nerve, which is cranial nerve 5, whereas the posterior belly is innervated by a branch of the facial nerve, cranial nerve 7. Also innervated by the facial nerve is the stylohyoid muscle, that's going from the styloid process of the temporal bone to the hyoid, and that's found in close association with that intermediate tendon and posterior belly. We also have the geniohyoid, which we can't see here, but is deep to the mylohyoid. Genio means chin to the hyoid bone. That's innervated by branches of the C1 spinal nerve that hitchhike along with the hypoglossal nerve. And finally, the mylohyoid muscle, which we can see very vaguely there. Mylohyoid goes across the inferior aspect of the oral cavity there. It is the floor of the oral cavity proper, and we'll discuss that in a subsequent lab. And that is also innervated by branches of the trigeminal nerve or cranial nerve 5. And then we have various muscles of the pharynx and larynx, which we'll discuss in greater detail in subsequent videos of this session. So the pharynx or the throat has very muscular walls to it, two sets. There are constrictor muscles, which we can see here, that serially constrict to squish food items along, as well as longitudinal muscles, which we can see there, that elevate and shorten the pharynx. So both these constrictor and longitudinal muscles act in concert with one another to change the shape and position of the pharynx, as well as position of the larynx during both swallowing and phonation, or making sounds for speech. Most of these muscles are innervated by the pharyngeal plexus, so the motor component of which is the vagus nerve, the sensory component of which is the glossopharyngeal nerve. The parasympathetic component, it comes from the vagus nerve, and the sympathetic component from the cervical sympathetic trunks, all to be discussed in much granular detail later. And we have the intrinsic muscles of the larynx, which we can see in association with the larynx there and there, which we'll discuss in greater granular detail later. These all affect the shape and orientation of the laryngoskeleton, so as to change the pitch and the timbre of sound as it crosses the vocal ligaments. And these are all innervated by branches of the vagus nerve. So that brings us to the assessment question of this video, and that is, a lesion of a vagus nerve may have what downstream muscular effects in the neck? Is it unilateral deficits of muscles affecting hyoid position? Well, hyoid position are suprahyoid and infrahyoids, so those are facial trigeminal branches for the suprahyoid, or ansa cervicalis for the infrahyoid, so that's not correct. Unilateral deficits of muscles affecting the larynx. Well, the larynx is innervated by the vagus, so maybe. Unilateral deficits of muscles affecting the pharynx. Well, the vagus is the motor outflow to the pharyngeal plexus, so maybe. Unilateral deficits of muscles affecting the hyoid, larynx, and pharynx. Well, we know hyoid is wrong, so that can't be. Or unilateral deficits of muscles affecting the larynx and pharynx. Yes, that is the most correct answer. So thank you for your time, and I will see you in the next video.